Okay, guys, we're going to do myasthenia gravis, and myasthenia gravis is on page 1437 in your book. Okay, another chronic autoimmune neurological disorder is myasthenia gravis. What happens, we're not sure why, but antibodies destroy the neuromuscular junction receptor sites for acetylcholine, and so this leads to a decreased number of receptor sites. And so when acetylcholine shows up, there's no place for the acetylcholine to hit, and therefore there's no muscle contraction. And so this is an issue with acetylcholine. And you can see the picture here that's depicting the fact that when the acetylcholine jumps to the postsynaptic cleft, there's no place for it to hit, and therefore there's no muscle contraction. Now, a lot of times what happens is a person notices the muscle weakness during like an acute infection, because that exacerbates the disease process. The signs and symptoms of myasthenia gravis fluctuate through the muscles throughout the body, but a lot of times these people do experience diplopia, dysphagia, dysarthria. They have issues with fatigue, weakening intercostal muscles, decreased diaphragm movement. They can have issues with chewing and swallowing and speaking and breathing. Because of this issues with the muscle weakness, they can develop complications such as aspiration, pneumonia. There are two different crises, though, that someone with myasthenia gravis could have. One is called a myasthenia crisis, which is a sudden exacerbation of the actual disease, the myasthenia gravis, where they have significant motor weakness, respiratory failure, and possible aspiration, versus a cholinergic crisis, which would actually occur because they've taken too much of the medicine that's used to treat myasthenia gravis, and they develop severe muscle weakness, vertigo, and respiratory distress. And so they have very similar presentations, and we'll talk about how to determine which crisis your patient is experiencing. This is just a picture showing you the drooping of the eye, very similar to the picture that you guys have on page 1438 in your book. Okay, as far as diagnostics, we take a history and physical on someone who is experiencing symptoms that are similar to myasthenia gravis, and then they do what we call a tensilon test. A tensilon test requires the patient to have tensilon given IV, and if they are positive for myasthenia gravis, the tensilon will actually improve their muscular strength. It is only a temporary improvement, then they'll return to their baseline. We also will see where they have delayed nerve conduction studies, and that they have some destruction of their anti-acetylcholine receptor antibodies. Now, we talked a little bit about the difference between the cholinergic crisis versus the myasthenia crisis. So what happens when someone comes in and they have very similar signs and symptoms, we give them a dose of tensilon. Okay, so the same drug that we use to diagnose it with, the tensilon. And so when we give someone the tensilon, then what happens is, for someone in a myasthenia crisis, it will improve their signs and symptoms, and someone in a cholinergic crisis, it will make their signs and symptoms worse. It's okay if that happens, because we're talking this is IV and it only lasts for a few minutes. The mainstay as far as drug treatment is the Mestinon, and the Mestinon is an anticholinesterase drug, and it is given on a daily basis. A lot of times these guys will take steroids or maybe immunosuppressants. Okay, so Mestinon is the most successful drug in the long-term treatment. Sometimes these patients will have to have their thymus removed. It seems that the thymus is involved in the production of these antibodies that are destroying the receptor sites, and so a lot of times these people will actually have their thymus removed. Plasmapheresis can be given during an exacerbation of the disease, and plasmapheresis will remove the antibodies during this critical time. Nursing care, there's lots of different nursing care considerations, but we're going to do an ineffective airway clearance because these guys have weakened respiratory muscles. So you want to make sure that you check their muscle strength. You want to make sure, especially if they're in crisis, we check their muscle strength because they actually could require intubation. We want to make sure that they have an effective cough and gag reflex. This is someone who we need to monitor their respiratory system frequently, checking the depth, the rate, their O2 sats, teaching them to turn, cough, deep breathe, making sure that they stay adequately hydrated, monitored, and in a semi-Fowler's position. As far as impaired swallowing, we want to assess their ability to chew and swallow. We want to give their med, the Mestinon. We want to give that 30 minutes prior to meals to improve their ability to chew and swallow. I realize that semi-solids may be easier for them to deal with and swallow than solids and liquids, and we want to watch these people's weight to make sure that they're staying nutritionally sound.